Hello, everyone. We're going to be exploring some different topics this week, some that come directly from the textbook and some that are adjacent to the information in the textbook, because sometimes the textbook kind of just gives us a little bit of a teaser on a topic and doesn't really go into great depth. So, starting off by looking at positive psychology, wellness, and post traumatic growth implications for the rehab counselor. Impact of a congenital or adventitious disability on an individual and his or her family poses many challenges regarding psychosocial adjustment, vocational options, and independent living function. In a situation where a disability is relatively stable, such as somebody after an amputation or after a spinal cord injury, planning for the future may not be as ambiguous or anxiety provoking as it may be for persons with unstable or uncertain diagnoses. There are, of course, situations where persons with a stable disability succumb to secondary complications, which then cause disruptions. In exploring factors related to disability and wellness, many disabling conditions as well as secondary complications can actually be minimized or even eliminated if individuals with disabilities were to adopt a wellness lifestyle. Hypertension, coronary artery disease, rheumatoid arthritis, GI disorders, substance abuse, anxiety disorders, and stroke all carry self-induced aspects within them. So this chapter is devoted to exploring disability and wellness. Many of the debilitating primary disabling conditions, as well as their secondary complications found today, can actually be minimized or even eliminated if individuals with disabilities were to adopt a wellness lifestyle. So looking at some terms, positive psychology, about valued subjective experiences, well-being, contentment, and satisfaction in the past, hope and optimism for the future, and flow and happiness in the present. Wellness, living well mentally, spiritually, and physically with illness, whether temporary or chronic. In our society, wellness is talked about, but often poorly integrated into our lifestyles. And again, health differs from wellness in that health is a state, whereas wellness is the pursuit of trying to achieve better health. And that pursuit can be through trying to do things that improve our physical state, our mental state, or our spiritual state. So chapter 24, at least in the old text, was a good chapter. However, some content vital to rehab counselors with theory related to positive negative aspects of well-being and wellness. So again, just like many chapters in this book, the focus is on the rehab counselor. But I think for us, since most of us are rehab professionals, we should focus on how we can address health and wellness for populations that we treat. So as I stated before, health is that state of being free from illness or injury. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Purpose of medicine then is to promote or restore health or wholeness. Optimal health has been defined as the conscious pursuit of the highest qualities of physical, environmental, mental, emotional, spiritual, and social aspects of the human experience. So we envision ourselves as people who promote health. Health promotion is the science and art of helping people change their lifestyle to move toward a state of optimal health. Optimal health is a balance between the domains of physical, emotional, social, spiritual, and intellectual health. So how do we promote health? Well, purposeful activities designed to enhance the health of oneself or others. For our clients and patients, this will require the patient or client to adopt lifestyle changes. To create lifestyle changes, there must be an enhancement of awareness. So education, a change in behavior. So education and motivation, and the creation of environments. The American Physical Therapy Association looks at wellness as concepts that embrace positive health behaviors that promote a state of physical and mental balance and fitness. A well-known PT PhD in the physical therapy world, Janet Besner, describes wellness as this. Wellness is about positive health actions. Wellness is a lifestyle process that never ends. And again, this figure here, if this helps you understand health and wellness, on one hand, the individual is pursuing wellness. Individuals running, trying to get fit. On the other hand, also demonstrating a lack of health. And we're making that assumption based upon the fact that he's smoking a cigarette. So health and wellness, again, are not the same thing. Health is that state, measured at a point in time. I am in good health. Wellness is that active process consisting of habits and practices. So someone can be healthy but not practicing wellness, and vice versa. One can be practicing wellness but not healthy. So for your homework, you're going to create a wellness plan for a population with a chronic disease or disability. This is going to be a chronic disease or disability of your choice. And so you're going to write up a short paper, and on this paper, submit it via email to me. Should have the following sections. A paragraph describing the population and how the disease or disability typically impacts their daily life. So how does it impact ADLs? What kind of impact does it have on their function? Then describe the impact on one's short-term and long-term health. For example, if you're talking about a chronic disease like coronary artery disease, discuss a little bit of the pathophysiology and how that could increase the risk of heart attack or stroke. And then evidence-supported treatments, interventions, and education to address health and wellness in this population. So maybe a paragraph would be related to evidence-based dietary considerations for individuals with coronary artery disease, where I would talk about the Mediterranean diet and reducing excess sugar and saturated fat. Treatments, I might discuss about the use of exercise and how exercise can potentially benefit the heart by decreasing LDL levels, increasing HDL levels. Maybe describing how exercise can improve blood flow or lead to the creation of different arterial branches. And so you're going to have 2 or 3 paragraphs discussing different treatments and interventions and maybe even education for this patient population. And then describe a program to reach this population. So this can be, again, about a paragraph or 2. And so could it be a program that's already been proven in the literature, or can it be something you create? And so something that we've created at George Fox University in our DPT program, we have developed a health and wellness clinic. And so we have these health screening clinics for vulnerable populations. And so it provides opportunities to reach out to underserved or uninsured individuals. So it's a mobile health and wellness clinic, and we've utilized tech. So we've created a health app, and we can collect information on that health app. And let me just go back here and talk a little bit more. So this health app basically is a way to enter in data into an iPad, and then at the end we can print off a scorecard illustrating strengths and weaknesses for that individual. So just kind of to illustrate the problem in our area, chronic medical conditions such as cardiopulmonary disease, stroke, cancer, obesity, diabetes, and arthritis, again, are leading causes of disease in the United States. Estimated that 7 in 10 deaths each year are the result of these chronic diseases. Individuals residing in rural communities, particularly vulnerable are particularly vulnerable to healthcare inequities. And so Yamhill County, where George Fox University is located, has these challenges. There are approximately 100,000 residents spread out over 700 plus square miles. The largest cities in Yamhill County are McMinnville and Newburgh. Newburgh is where George Fox is at. Each of them have a small hospital. However, there are numerous cities and unincorporated communities spread throughout the region, with many cities lacking a primary care provider office. So as I mentioned before, the DPT program of George Fox University is in Newburgh. We're about 30 minutes west of the Portland, Oregon area. Newburgh's about 22,000 people or so. And again, even though we are in Yamhill County and near Portland, it can require up to 30 minutes to access, into Portland to be able to get to a specialist. There are some specialists in Newburgh too, but many people are located outside of the Newburgh McMinnville area and might have 30 minutes or more to drive to get to someplace. Statistically, there are only 62% of residents in the Yamhill County area that have a usual place of care, and only 48% of residents have a personal doctor. So access to types of care is challenging. Chronic medical conditions are prevalent in Yamhill County. The leading cause of death in Yamhill County are cancer, heart disease, chronic lower respiratory disease, and stroke. In a survey of Medicaid-eligible individuals in Yamhill County, 69% reported at least one chronic medical condition. Unfortunately, not everyone are able to access care. 23% of adults in Yamhill County under the age of 65 are uninsured. This is above both the state average of 21% and the national average of 15%. Many of the aforementioned chronic medical conditions may be preventable. However, without the ability to access care, one faces an increased risk of morbidity and mortality. So with our health and wellness clinic, utilizing the iPad and the health app, we created 6 different stations to assess different particular domains of health, like orthopedic health and cardiopulmonary function. And then, as we set up an area, students lead these groups as people go through the different screening sections. Some of the tests are very low tech, some of them are higher tech. And this is just an illustration of the health and wellness app that was created. Now, reason I bring this up again is as we come back to our homework assignment, looking at number 4 here, this is describing something I would create. You, on the other hand, you can be describing something you might create education-wise. Maybe it is creating YouTube videos and having a channel that people can access. Maybe there is something else in the literature you are familiar with that you would describe. But this is your homework assignment here, so it should be, again, as we go over things, about a couple pages. Make sure to use citations. All right, let's now talk about successful aging. So, gerontology reflected and reinforced the decline and loss paradigm in the past. And in the last 20 years, we've witnessed successful aging. This popular perspective holds that many of the health and related problems associated with normal aging are in fact not normal at all, rather are the result of lifestyle and other factors that put people at high risk for disease and disability later in life. The concept of successful aging has been helpful in focusing renewed attention on health promotion and disease and injury prevention as a means of adding life to years and not merely years to life. So emphasis on successful aging has been criticized. And I guess what they're talking about here in some of these concepts are looking, especially like when we talk about race, class, and gender, inequities, any research that's been done on successful aging oftentimes focuses on white males and individuals that have financial means. And that sometimes too with successful aging, there is maybe lack of focus on the value of losses and gains later in life. So, not to focus on that, looking at successful aging, originally defined as aging while avoiding disease and disability. Now it includes the original definition, as well as maintenance of high physical and cognitive functional capacity and active engagement in life. The avoidance of disability involves increased rather than decreased attention to preventative health care and health promotion in later years. So it's important to have maintenance of high physical and cognitive functional capacity, to have active engagement in life. The avoidance of disability involves increased attention to preventative health care and to health promotion. Maintaining physical and mental function also involves an awareness on both prevention and health promotion. Successful aging suggests that maintaining close relationships with others and remaining involved in activities that are meaningful and purposeful are important for well-being throughout the life course. Some can be successfully aging, however, this does not mean that they are free from disease. Disease and disability is not wholly under our control. Encouraging, maintaining proper diet and exercise can help. Some components of successful aging include exercise, diet, positive pursuits, cognitive engagement and curiosity, and maintaining connections. All right, so your homework was discussed earlier in this short lecture here, and your forum would like you to discuss what successful aging looks like to you.